Generalized anxiety disorder can have a range of presentations, from a less severe form of the illness where you might get the palpitations, the muscle cramps, the tension, the apprehension, the worry, but you can still get to work, you can still go on. Or it can range to very severe where it's affecting your job, it's affecting your relationships with friends, family, and colleagues. And depending on the severity, one might need treatment for it. And so this video is all about that. We're going to talk about the treatment for generalized anxiety disorder. We'll start by talking about the decision to treat, so when you need to treat versus when you don't. We'll talk about the different treatment options, so whether we're talking about psychotherapy with a psychologist or medications with a psychiatry, or both. We'll talk about some of the common first-line medicines used, and we'll also talk about what we do if the first-line medicines don't work and you need a second-line medicine, what some of the options are. We'll talk about benzodiazepines, and we'll also talk about complementary things you can do on top of the recommended management strategies. And then finally, we'll talk about the duration, how long we need to treat illness for. If you're new here, hello, my name's Dr. Sil. I'm a junior doctor working in Sydney, Australia in mental health, and in my free time when I get some, I love making YouTube videos to help educate and empower people around mental health issues. If that sounds like your cup of tea, then you can support me by leaving this video a like and subscribing to the channel. Let's get into it. Now, an important note to make is that this video is for generalized anxiety disorder. So that means someone has been diagnosed with it. To get a diagnosis, you need to talk to a mental health professional or a psychiatrist. You cannot diagnose yourself on YouTube or on the internet. It is far too complex a thing in mental health to get a diagnosis. Sometimes you need to meet with a mental health professional multiple times and be observed over time to establish a diagnosis. Not only that, but it's important that you see a mental health professional in case there are other diagnoses, like comorbid diagnoses. It's very common in mental health that one might have generalized anxiety disorder and agoraphobia, and a substance use disorder. And so the treatments need to be tailored and individualized. So the purpose of this video is not diagnosis. It is simply education and empowerment so that when you talk to your psychiatrist, you have the knowledge to ask better questions and have better insight into what they're thinking. So step number one in the treatment of generalized anxiety disorder is to decide, do they really need treatment? So it's a spectrum of severity with generalized anxiety disorder. Everyone has their own journey with the illness. And if you are functioning and you're getting the symptoms, you actually can just try not getting any treatments for a little while. See how it goes at work, see how it goes with your friends and family, see how it goes leaving the house. If you're still able to do things that you want to do and you're still hitting your goals, you can just be monitored, be checking in every month or so with your healthcare professional. If, however, it crosses that threshold, it starts affecting you in a serious way, you're not sleeping, you're having problems with your work, you're having problems with your relationships, then that's when you kind of want to start reducing the symptom severity, and that may require treatment. As I said before, treatment requires an accurate diagnosis. So if you have other comorbidities, such as like substance use issues, where maybe you're drinking too much or doing whatever you're doing, then you need to treat both things. You can't just treat the generalized anxiety disorder. You have to treat the whole picture individually, right? You or someone you love needs treatment. The first decision to make is, are we going for medicines, for psychotherapy, like psychology, or both? Quick off the bat, just to save you some time, if you want to end the video now, do both. That's my suggestion. But there are options for all three. Really, in anxiety, psychotherapy is so important. There are genetic risk factors for developing a generalized anxiety disorder, but it's often triggered by environmental things like personality and events in childhood that might need to be unpacked. Psychotherapy can really help with that. And also CBT, the main psychotherapy, can help you develop kind of strategies to address the symptoms you're experiencing. That being said, if you're too anxious to even talk and have a conversation and think about the symptoms you're experiencing, then you're gonna need medicines to bring the intensity of the symptoms down so that you can do your psychotherapy. And in that sense, I always use the analogy that medicines are kind of like a good pair of boots, all right? You need the boots if you're gonna walk up the mountain, but you still need to walk up the mountain, and that mountain is psychotherapy. That's working with your psychologist, talking through the symptoms you're experiencing, where they originate from, and kind of unpacking strategies around how to deal with those symptoms. But you still need boots to climb that mountain. So it's still hard work, but it makes it a little bit easier. What you do see, unfortunately, commonly with generalized anxiety disorder, and let this be remembered forever because I need you to recognize this, and I've heard senior psychiatrists say this, people might take the medicine and that acts actually in a counterintuitive way to make things worse because they avoid the psychology. They think, oh, I'm taking a medicine, I don't need to do the psychology work. It's muting the symptoms. No, unless it's too traumatic to go through, I really think that medicines are there to augment and give you capacity to do the psychotherapy. You really need to work with a psychologist. If you've had shit psychologists in the past, I'm sorry about that, but also remember, the number one thing that suggests whether psychology will work for you is if you have a good relationship with the psychologist, which means sometimes you've got to shop around. You've got to try different ones out, see where you have a good rapport. You don't have to love them, you don't have to like them, you just have to respect them and work well with them. Now, if you want to do either CBT or medications, CBT being the psychotherapy called cognitive behavioral therapy, that's just the acronym for what we use in anxiety. Different people might want different things, okay? So people who are scared of side effects of the medications, then maybe they'll want to do the psychology work, the CBT. People who want an impact quicker might want to do the medications because you might start seeing a response within 2 to 6 weeks. You see the efficacy of the effectiveness of the medicine. Which one is more effective? Well, there's a host of different studies. All these ones that I'm highlighting right now all show that if you do either CBT or the medications, they're roughly similar in their effectiveness. But if you do both together, it's better than using one or the other. And I forgot to mention, but another big consideration for doing medicines is cost, because doing psychotherapy with a psychologist, whether you like it to admit it or not, it costs a lot of money. Or if you're in a part of the world that doesn't have psychologists, then maybe all you have is medicine. In which case I would just strongly recommend having good friendships where you can debrief regarding some of the stresses you're experiencing. So let's talk a bit about the data around the medicines and the psychotherapy. So look, although medicines can help reduce the symptoms experienced in generalized anxiety disorder, and yes, there's a big range, some people respond more than others, we should be realistic and recognize that it's usually a modest effect. So this meta-analysis, analysing 89 trials with over 25,000 individuals with generalized anxiety disorder, compared treatment of over 20 different anxiolytic drugs compared to placebo. They found an improved anxiety symptoms, but only modestly, about 4 points on the Hamilton Anxiety Rating Scale, which is a 56-point scale. Now, how do I interpret that? Look, the way that I see it is it's definitely worth trying medications to help with your anxiety. It's not going to be the amazing silver bullet that just fixes all the problems. It's going to be part of a multimodal strategy to fix the mental health problem. And I guess it comes down to this. Mental health problems are complicated in cause. There's multiple different things that lead to a cause of a mental illness. And so guess what? The treatment's going to be complicated and going to need multiple different modalities, different strategies to fix it. If the cause is complex, the treatment is usually complex too. Now, with cognitive behavioral therapy, the evidence is pretty impressive. So meta-analyses of multiple clinical trials have shown that compared to placebo, treatment as usual, and wait lists, there is a significant effect on doing cognitive behavioral therapy and reducing the symptoms, and even more so than other psychotherapy techniques like dialectical behavioral therapy or exposure response prevention therapies, other types of therapy. So not only does CBT work well for generalized anxiety disorder, it works for multiple different anxiety disorders, and it works for a lot of people at delayed follow-up. So this meta-analysis actually looked at 87 different studies, and they checked in with the people after completing CBT, and almost 50% of people still had a positive response years later after doing their CBT for anxiety. But as I said, the evidence is really in the combination of both, okay? A plus B is greater than A or B. So yes, we've talked about psychotherapy, and the one that's recommended is cognitive behavioral therapy that you do with a psychologist, and that trains you to identify unhealthy thought patterns, apply logic to it, and train yourself out of doing unhealthy behaviors. And now we'll talk about the medications. So that really first line recommendations medically for the treatment of generalized anxiety disorder is serotonergic drugs such as selective serotonin reuptake inhibitors or serotonin and noradrenaline reuptake inhibitors. So the selective serotonin reuptake inhibitors are things like fluoxetine, citalopram, escitalopram. These work modestly well for a first try, but they have different side effect profiles. Because if someone is sensitive to weight gain, they would avoid citalopram but try fluoxetine. But individuals who are worried about the sexual dysfunction, you would avoid paroxetine and try duloxetine. And look, please don't stress if the first medicine doesn't work. There are so many other options. We have algorithms to follow with lots of different options. So just because fluoxetine doesn't work, then we can try a SNRI, something like venlafaxine. And if that doesn't work, that's okay. There's other things we can try. There are atypical antidepressants now being used as second or third line, like mirtazapine, and that works particularly well. If someone is not eating or not sleeping, mirtazapine can help you fall asleep better. It can also help you get your appetite back. Agomelatine is another new one that's finding its feet. It's not a serotonergic drug. It actually works on a sleep-wake melatonin circadian rhythm pathway. It has very little side effects, very safe to have, and no side effect profile, so that's one to consider as well. And the point here isn't to tell you what to take. The point is to show you that there are lots of options out there. So do not stress if the first one doesn't work, and work with your doctor to find out which one works for you, given the kind of concerns you might have around side effects. And although some people have side effects, guess what? A lot of people don't experience any side effects. And with generalized anxiety disorder, you might not even need that higher dose, so it makes it even less likely that you get side effects. Don't stress, don't assume that you're definitely going to get side effects so you can't even try. Everyone's different. Now, if a single agent therapy doesn't work, there are options to augment SSRIs or SNRIs with other medicines. That gets pretty technical, I'll leave that with your doctors, but things like gabapentin, buspirona are options to add to a kind of cocktail approach if needed. But I think now we're going to talk a little bit about benzodiazepines. Now, benzos cop a lot of hate. It's important to be realistic around them. They have potential to develop tolerance and addiction and decrease efficacy over time. So you get dependence and tolerance. It's a bad mix if you take them regularly over long periods of time. But sometimes your symptoms are so severe that you can't even function, you can't go about your day, you can't engage in conversation, you can't engage in psychotherapy, which is the key thing to achieve with generalized anxiety disorder. When it's so severe that nothing else is working, you can consider short-term benzodiazepines as needed. So maybe it's just to help get a couple of hours of sleep, and this needs to be negotiated with your doctor. But it is very nuanced discussion, and some people shouldn't have them. And so I can't tell you if you need them or not, or if you should have them or not. And if you talk to anyone who's developed a tolerance to benzodiazepines or become addicted to benzodiazepines, they'll tell you that coming off of benzos is one of the hardest things they've ever done in their life, if they've achieved it, because it's really, really hard. The symptoms are horrible, so you do want to avoid it. That being said, if you and your healthcare professional decide that it's right for you and you're taking them for less than a month, or you're taking them on an as-needed basis, then please don't stress. Just check in frequently with your healthcare provider around the effectiveness, and if you're finding that it's decreasing in effectiveness, let them know. Now let's cover some of the complementary treatments. There are multiple different complementary treatments. There are physical, cognitive, spiritual activities that you can try. Try them all. I have nothing wrong with complementary stuff. If it works for you and it's not too expensive or causing you any stress, that's what we should do. So I guess the things that do have evidence are things like exercise. So high intensity interval training has good evidence to suggest it helps with anxiety. Aerobic exercise as well, if you guys are medically capable of doing it. Mindfulness-based stress reduction and yoga may also be helpful, as they have also been shown to reduce symptoms of generalized anxiety relative to education control conditions. So there's a lot of hope there. And it shows that you should be using these in addition to the medicines and the psychotherapy. It all works together. The final thing to add in terms of therapy is to make sure you're having a healthy lifestyle. If you can, please try eat healthily. Please try keep your exercise up. Get exposure to sunlight during the day, and that'll help your circadian rhythm keep its rhythm, essentially. It's all based on light. Listen to Huberman Lab podcast if you don't believe me. That guy loves light. Essentially, if you find that there's a positive benefit from the pharmacotherapies, from the medicines, then you should continue it for at least 1 year after the resolution of symptoms, and then you can try weaning and see what happens. In trials where they've tried continuing the medications versus a placebo medication, you do find a very different rate of relapse. So people who continue with medications will have about a 10% rate of relapse, but if you're on the placebo, that group had a almost 53.7% rate of relapse. So yes, you can try weaning the medications, for example, if there are side effects you don't like or it's unaffordable, but just be aware that there's a risk of relapse. So I guess it's a good point now to say that the medications do not cure anxiety disorder, they just mute the symptoms while you experience it, and the psychotherapy is really where you have to do the work to kind of get to the core of it. In terms of how long to do the cognitive behavioral therapy for, usually around 10 to 15 sessions is average, but it kind of depends on the individual and it's up to the psychologist to kind of gauge that. And some evidence has shown that if you have booster monthly sessions, once a month after you finish your CBT sessions with the psychologist, you can actually have positive outcomes with some anxiety disorders. Alright guys, thanks for staying till the end. I hope you found it helpful. If you did find it helpful, please click the like button and subscribe to the channel. Comment down below what state or country you are commenting from, and tell me a bit about the mental health services that are available in your area. I'm interested in knowing which places do well and which places don't do so well. You can follow me on Instagram at Dr. Windowsill. I'm on TikTok, Instagram, Twitter, I'm on everything. So if you want to join me, please do. And I wish you all an absolutely beautiful day, and I'll see you in the next video. Bye for now.